Good morning everyone, this is Claire Watson from Xcite Training in lockdown with everyone else, and I'm getting lots of queries about parent first aid. So what I thought I'd do this morning is just give you a quick demonstration. If you are at home having a lovely time hopefully with your family, there are lots of young mums that are learning things like weaning, taking care of their babies, and one of the biggest, scariest things about that is parents worry about choking. So what is choking? Well, choking is a complete or a partial blockage of the airway. Inside your throat, you've got two tubes, one's for feeding, one's for breathing. And if something that should have gone down your feeding tube ends up going down your breathing tube, it hurts. And your body's natural response is to cough and to try and get rid of that. And most of the time that does a brilliant job. It's at the top of the airway, it clears it, and you cough and you splutter. And babies and children do that a lot. They're always putting stuff in their mouth to explore their environment. And when they're eating, sometimes if they're not sitting down and moving around, it can be quite tricky to do that. So have them sit still while they eat, that's number one rule, and make sure you're with them and supervising them. What happens then if they do get into trouble? So we're going to talk about babies this morning. I've had a lot of queries about babies and weaning and stuff like that. So under 6 months, babies predominantly have a milk diet, but once they get to about 6 months, they try all sorts of exciting foods. And what do we do if they cough and splutter, which is normal? You know, it's quite hard for them to be able to manage all their foods and their different things. So it's quite normal for them to cough. That's the body's natural response, as I said, if something gets stuck, and it's a really powerful response, okay? If, however, they're sitting in their high chair and they're coughing, I don't wait to intervene a little bit. So what I would do is I'd undo the straps of their high chair because they're normally in a big harness. That way you haven't got to panic to try and get them out if they get into real trouble. But most of the time they'll have a few coughs and they'll get rid of it. If, however, it gets stuck, I'm going to show you what to do. So we've got my 6-month-old here. This is Fred, and Fred has been weaning this morning. As I say, he's sitting in his high chair, and he's coughing and spluttering because he's had a bit too much toast, and he's been storing it in the roof of his mouth, which babies are very good at doing. And he's having a bit of a tough time. So I've undone the straps of his high chair. He's still coughing and choking, so I'm going to get him out, because gravity is going to help me to clear this object. Okay, so I'm going to get him out of the high chair. And if you've done any first aid before with babies, you may have been taught how to hold your baby. So to help, let gravity help us, we're going to put baby in a downward position, and we say head lower than bottom. In order to do that, the baby's head is really heavy. So you're going to support the head, okay, that's really important. And the best way to do that is to have a grip around this jawbone, okay, not around their neck or anywhere else, just around this jawbone. And that will support the weight of the baby's head, like you would if you were sitting up weaning after a milk feed, giving your baby a bit of a wind. So you're going to hold on to the head. And you can put the baby across your arm like that, so that you've got good grip on the head. After about 6 months, they get quite heavy, so you may need to sit down, put baby over your knee as you sit in a chair and hold baby that way. But whichever way you do it, make sure you've got a good firm grip of baby, head lower than bottom, and I'm going to administer, if baby's still coughing and choking, I'm going to administer 5 back slaps. If the baby's making some noise and is coughing and choking, that's telling me that there's some air still getting through. So I've got a bit of time to be able to do this. So I'm going to hit firmly between the shoulder blades, and you'll start off really gentle like this because nobody wants to hurt the baby and hurt it. But actually a couple of good firm smacks on the back will see that object, that bit of food or toy or whatever it is, shoot out hopefully and hit the floor. Baby will scream and you can stop, okay? If, however, the object is stuck further down or the baby's making no noise at all, that's telling me that the airway is completely blocked. So a couple of good firm smacks. And the textbooks will tell you up to 5. Keep checking. You'll know if it's come out because the baby will scream its head off. If that happens, take baby, put it on its side in the recovery position, head slightly down, good support of the body, and just keep an eye on it. Make sure it's breathing properly and everything's cleared, okay? If, however, you haven't got it out after 5 back slaps, and I think most people understand when you're choking, it's a good idea for someone to hit you on the back. There is another technique that in 50% of the cases you might need to employ if this thing is stuck much further down the windpipe, okay? So you're going to turn baby over at this point. You still need to support the head, so baby's on their back, and we're going to measure under the armpits into a straight line and I'm going to use my 2 fingers here across the armpits into a straight line on that hard breastbone, okay? These are called chest thrusts on a baby, and we're going to push inward and upwards. I'm just going to swap hands because I'm right-handed, so I find it a bit easier. There we go, measure underneath the armpits, and I'm going to push inwards and upwards, okay? And what I'm trying to do is make like a false cough, push oxygen up and under the diaphragm. Here I go. 1, 2, 3, 4, 5. Baby is still fighting, trying to cope with this thing, trying to get it out. That's not worked. If that hasn't worked, turn baby back over, support that head. As we did before, 5 back slaps. 1, 2, 3, 4, 5. Now I am hitting the baby with some force. So whatever happens, if this thing flies out, the baby's fine, you still need to get the baby checked out with a paediatrician just to make sure that you haven't bruised anything, damaged anything. But at this point, I'm still going. Baby is still not cleared their airway. Parents then say to me, well, when do I call an ambulance? Obviously, we don't want to abuse our ambulance service, but actually, this is an airway obstruction, so it's quite a serious, it's a serious issue if the thing is well and truly stuck. So my advice is always to say, if you have forgotten what to do, you've forgotten these techniques, call an ambulance because they will talk you through what to do to clear that airway obstruction. But the textbooks will say don't wait longer than 3 rounds. So 5 back slaps and 5 chest thrusts is 1 round. So don't wait longer than those. But honestly, they're fantastic. They will talk you through, keep you calm, help you figure out what to do if things aren't working. So do call them. The other thing people say is, do I just keep going? So we've done the 5 back slaps, 5 chest thrusts, and we're rotating between those 2 techniques. At some point though, if you cannot clear this object, there's no oxygen getting to the baby's brain, so the baby will pass out. So the moment the baby goes limp and loses, has passed out, has lost consciousness, that's the word I was looking for, we need to employ a different technique. So now what we're going to do, because we know what's happened, we know there's an object stuck in their airway, we're going to put baby onto a hard, flat surface, okay? And you put baby down on a hard, flat surface, you're going to tilt the head into what we call the neutral position to open up the airway, and we're going to administer 5 big breaths into baby. Now, parents say to me, why are we breathing into the baby? There's something stuck down the airway. But actually, what we're hoping now is that now baby is completely unconscious. Everything's relaxed. All the muscles are relaxed. And what we're just going to put baby down. What we're hoping is that now the muscles are relaxed, there's gaps, air gaps, and we can get some air past that object. And we're hoping we can actually blow it into one of the little lung cavities, because they're down your airway, you've got openings for your lungs. If that happens, what will happen is the other side of the chest will start to move and the baby will start to breathe on that one lung. Obviously, they need to get to hospital. We need to clear that object from the lung. So you're going to do full resus. So you're going to give 5 rescue breaths to start with, and then you're going to do compressions on the baby. And I'll probably make another video to show you properly, but basically, again, you measure under the armpits to the centre of the chest on that hard chest plate. Using 2 fingers, you're going to push down quite hard and quite fast. It's 2 per second, and it's quite a long way. It's roughly 4 centimetres, which is at least 1/3 of the depth of the body. And you're going to rotate, and you're going to do 5 rescue breaths, 30 compressions. 2 breaths, 30 compressions. 2 breaths, 30 compressions. Keep putting air in, push that oxygenated air up to the brain. Keep going until the ambulance arrives or the baby wakes up. And obviously, if you've cleared the airway, great. If you've got one side of the chest moving, it's got to go to hospital, but they're going to need to be checked out anyway. Now, I've taught you all this not to frighten you. It is super rare for a baby to get into that much trouble. Most of the time, the cough will clear their airway. But we all know babies are great at putting everything in their mouth. So toys and food and anything that they want to explore their environment from. So hopefully if you've got the tools and the knowledge to get started while you wait for the paramedics, you'll feel a lot more confident. Thanks for listening, guys. I shall be back with more as time goes on, but really nice to see you all this morning.